There is a particular kind of brain that has puzzled researchers for decades. It comes from someone who lived past 100. Someone whose family will tell you they were sharp to the end. They knew the names, they followed the conversation, they remembered where they put their glasses more often than their grandchildren did. And then the brain arrives at the laboratory, and the scientists look inside, and they find it packed with the exact damage that is supposed to cause dementia. Amyloid plaques, tau tangles, the whole picture. The same picture you would expect in someone who spent their final years unable to recognize their own children, except this person recognized everyone. For a long time, cases like this were treated as strange exceptions, curiosities, files in a drawer. Now a team of researchers has gone looking at those brains on purpose, and what they published this week gives us the clearest look yet at why two brains can carry the same damage and end up in completely different places. What I can give you today is the mechanism, the actual description of what appears to be happening inside that tissue and why it differs between one person and another. That is the interesting part, and almost nobody is reporting it properly. What I cannot give you is a to-do list, and I will explain exactly why when we get there. This study has a particular shape that decides what it can and cannot tell us, so let us go look at what they found. The study came out of a collaboration between research institutes in Belgium and the United Kingdom, together with a biotech company, and it was published in the journal Nature Medicine on the 26th of July. And the material they worked with is the part that matters most. There were no mice in this study, and no cell cultures in a dish. What they worked with was human brain tissue, donated after death, including tissue from people who had passed the 100-year mark with their thinking intact. That last part is rarer than you might imagine. To study a healthy 100-year-old brain, you need someone who lived to 100, stayed cognitively well, and arranged to donate their brain to science. Every one of those brains is close to irreplaceable, and it is worth pausing on what a brain bank actually is, because most people have never thought about one. Somewhere in a research institute there is a room, kept cold, holding tissue that people arranged to donate while they were alive. Each donation comes with paperwork signed years earlier, usually by someone who was perfectly well at the time and simply decided that when they were finished with their brain, science should have it. The healthy ones are hardest to come by. Plenty of people donate after a diagnosis, wanting their illness to be studied. Far fewer donate after a long life of thinking clearly, because nothing ever prompted the conversation. That imbalance shapes what science can ask. For decades, researchers could describe the diseased brain in enormous detail and had comparatively little to say about the brain that aged well. You cannot spot what protects people if the only brains on the shelf belong to people who were not protected. Which is exactly why a study built around healthy centenarian tissue is unusual enough to be worth your time. Before the finding itself, there is one thing about Alzheimer's disease that almost everybody has backwards. For most of the last 30 years, the story told to the public was fairly simple. A protein called amyloid builds up in the brain and forms clumps, plaques. Another protein called tau builds up inside the brain cells and forms tangles. Plaques and tangles damage the brain. Damaged brain, lost memory. Simple, clean, and as it turns out, incomplete. Because here's the uncomfortable fact that has been sitting in the literature for years. Some people have the plaques and the tangles and never develop dementia. Not a few, enough to be a real pattern, which means the damage alone does not decide the outcome. Something else is involved. Something that lets one brain carry that burden and keep working, while another brain carries the same burden and does not. And this is where a distinction hides that trips up almost every conversation about this illness, including, for years, conversations among doctors. Alzheimer's disease and dementia are not the same word. Dementia describes what a person experiences, memory going, judgment slipping, the gradual loss of the ability to manage a normal day. It is defined by symptoms observed in a living person. Alzheimer's disease, in the strict pathological sense, describes what is in the tissue, plaques, tangles, a pattern a pathologist can identify under a microscope. Most of the time, the two travel together, which is why we use the words as though they were interchangeable. But they can come apart. A person can have the tissue pattern and never develop the symptoms. That is precisely the group at the center of this study. Once you see that gap, a lot of confusing headlines suddenly make sense. When you read that a scan found signs of Alzheimer's in someone with no symptoms, that is this gap. When you read that a drug cleared plaques but patients did not improve much, that is this gap too. And that gap is where this study went looking. The new research points at a suspect. And the suspect is not a protein at all. The suspect is a cell. Your brain has its own immune system. It does not rely on the same white blood cells patrolling the rest of your body because the brain is walled off from your bloodstream by a very selective barrier. So it keeps its own security staff on site. Those cells are called microgliae, and the reason your brain needs its own dedicated staff is worth a sentence because it explains a lot about why brain disease is so stubborn. Most of your body is patrolled by immune cells traveling in the bloodstream. When you cut your finger, they arrive through the blood. Your brain does not work that way. It sits behind a barrier, a lining of blood vessels so selective that most things circulating in your blood simply cannot cross into brain tissue. That barrier is a marvel of protection. It also means the brain is, in immune terms, somewhat on its own. Whatever housekeeping needs doing in there has to be done by residents, not visitors. Microglia are those residents. They arrive early in life, settle into the tissue, and stay. The ones in your head now have, for the most part, been with you a very long time. If you have never heard the word, you are in good company. For most of the history of brain science, microglia were treated as background, support staff, the cells that clean up debris while the neurons do the important work. That view has collapsed over the past 2 decades. Microglia are now understood to be active, responsive, and enormously influential in what happens inside the brain. Picture them as a small crew of caretakers moving through the tissue. They inspect. Waste gets cleared away. Anything that should not be in the tissue gets wrapped up and dealt with. And critically, they change their behavior depending on what they encounter. That last point is the whole story. Microglia are not one fixed thing. They shift into different states, and each state comes with a different set of jobs. A microglial cell dealing with ordinary housekeeping behaves differently from one that has just found something alarming. And what this research traced was the sequence of those states in brains that had the damage, and how that sequence differed depending on whether the person developed dementia. Here's what they describe. In an early phase, the microglia move into an inflammatory state that is tied to the amyloid plaques. They react to the plaques. They surround them. That reaction, in itself, is not a sign of catastrophe. It appears to be what these cells do when plaques show up. Then later comes a second state, a different mode entirely, described as an antigen-presenting state, meaning the cells start behaving less like cleaners and more like messengers, holding up pieces of material as if to say to the rest of the immune system, look at this. In that second state, the researchers found appears alongside tissue pathology, alongside the tangles. That shift, from the first state to the second, is what the team describes as a possible tipping point, not a switch that has been proven to flip the outcome, a point where the picture changes and where the difference between the two groups becomes visible. Now I want to show you the part I find genuinely remarkable because there is not one story here. There are two. The researchers looked at people who had the brain damage without the dementia, and they did not find one single pattern of resilience. They found 2 different ones in 2 different groups. The first group were people in their 80s, plaques present, no dementia. In their tissue, the microglia showed the early response, the inflammatory state tied to the plaques, and then never moved on. The later state, the antigen-presenting one, never appeared. Partway through, the sequence simply stopped. Now to the second group, the centenarians, those past 100 who stayed cognitively healthy. Their brains did something else entirely. Their microglia did activate the later program. The second state was there, but it showed up decoupled from the tau pathology. That difference is subtle, and it matters enormously. Among the 80-year-olds, resilience looked like a process that never started. Among the 100-year-olds, resilience looked like a process that ran, but ran disconnected from the damage it is normally found sitting next to. 2 completely different routes to the same outcome. A brain carrying the hallmarks of a disease in a person who never lost themselves to it. You would not expect that from one simple protective factor. You would expect it if the relationship between damage and dementia runs through a system with several possible configurations. There is one more piece of vocabulary worth unpacking because it carries the finding, antigen presenting. It sounds like jargon, and it is, but the idea underneath is simple. An antigen is just a fragment, a piece of something the immune system might want to react to. To present it means to hold it up. A cell in this mode takes a fragment of material, displays it on its surface, and effectively puts it on show for other immune cells to inspect. In the rest of your body, that is how an immune response gets coordinated. One cell finds something, displays it, and other cells decide what to do about it. Seeing brain cells shift into that mode tells you the situation has changed. These are no longer caretakers quietly tidying up around a plaque. They have started signaling, and the timing is the part that caught the researchers' attention. That signaling mode showed up alongside tau, the tangles, rather than alongside the plaques, which fits something clinicians have suspected for a long time, that tau tracks the loss of function more closely than amyloid does. The plaques arrive early and can sit there for years. The tangles track much more closely with the years when a person is actually slipping. Let me put some scale on why researchers care so much about this question. By the most widely cited estimates, Alzheimer's disease affects more than 55 million people around the world. It is not a rare condition, and it is not a distant one. If you are watching this, there's a reasonable chance you have sat across a table from someone whose memory was going and felt that strange helplessness of not knowing what to say. And for decades, the great frustration in this field has been that the obvious target kept not working. Treatments aimed squarely at clearing amyloid have had a long and difficult history. If plaques were the whole answer, removing them should have worked better than it has. Findings like this one offer a possible reason why. If the damage is only part of the equation, and the response to the damage is the other part, then a treatment aimed only at the damage is working on half the problem, and that too needs a warning label. It is a line of reasoning, not a conclusion. The researchers describe what they observed in tissue. Turning an observation into a treatment is a road measured in years, and most attempts along that road never arrive. Still, you can see why a finding like this draws attention. Now let me deal honestly with the limits, because you deserve them. Every sample in this work came from a brain examined after death. It is a snapshot, not a film. Researchers can see the state the cells were in at the end of a life. Rewinding to watch how those cells got there is not available to them, which leaves the direction of the arrow genuinely uncertain. Did the microglial behavior protect the person from dementia? Or did some other difference in that brain produce both the microglial behavior and the protection? From tissue alone, that cannot be settled. The researchers are careful about this. Their language is that the microglial state may help determine who develops dementia. May help determine, not decides. That caution is worth repeating, because this is exactly where headlines go wrong. The gap between may help determine and decides is the entire scientific question. One more limit worth naming: the number of healthy centenarian brains available anywhere in the world is small. Small numbers make patterns harder to trust. A finding like this opens a door rather than closing one. There is also a question this study does not answer, and I think it is the most interesting one left on the table. Why do the microglia in one person behave differently from the microglia in another? Nobody knows. It could be genetic. Perhaps it comes from the rest of that person's immune system, or from the particular way their disease progressed. Or it could be several of those things braided together in a way that will take another decade to untangle. When a study finds a difference, the natural next question is where the difference comes from. On that, this work is silent, and honest about being silent. There is one more thing in this study that I keep turning over, and it has to do with the 80-year-olds rather than the centenarians. Think about what their tissue showed. The early response happened, the later one never did, and the sequence stopped partway through. If you were designing a protective mechanism from scratch, that is not what you would draw. You would draw something that fights harder, not something that stops early. And yet in that group, stopping early is what traveled alongside keeping their memory. It raises an uncomfortable possibility that runs through a lot of modern immunology. Sometimes the damage that finishes you is not the original injury. It is the response to the injury carried on too long. We know this pattern from other parts of medicine. There are illnesses where the immune reaction does more harm than whatever set it off. Nobody has established that Alzheimer's works that way, and you will not hear me claim it does. But it is the sort of question this kind of study puts on the table. And it is a very different question from the one the field has been asking for 30 years. Here's a second thing worth holding on to, and this one is about how you read the news. Over the next few months, some version of this study will reach you again, reshaped. It might arrive as a claim about a supplement that supposedly influences microglia, perhaps as a diet said to reduce brain inflammation, or attached to a product with a scientific-sounding name. When that happens, the question to ask is simple. Was that tested in living people, and did it change what happened to them? For this research, the honest answer is no, because that is not what the study was built to do. It looked at tissue. It described a pattern. That is a real contribution, and it is a limited one, and the people who did the work say so themselves. Anyone who skips past that limitation is not reporting the science. They are borrowing its credibility. So what should you take from this? Not an instruction. I have said that 3 times now, and I will say it once more, because the temptation to convert every brain study into a shopping list is strong, and it is wrong. What you can take is a change in the picture. The old picture said, Damage accumulates, memory goes. One arrow, one direction. The picture emerging now says damage accumulates, and then something in the brain responds to that damage, and how that response unfolds appears to travel alongside whether the person loses their memory or keeps it. That is a more complicated story. It is also a more hopeful one, in a specific and limited way, because a response is something that might one day be influenced, while accumulated damage in an old brain is very hard to undo. Might one day. Not today, and not by anything you can buy. Let me put one more frame around this before we finish, because I think it changes how you will read the next headline about dementia. For 30 years, the public conversation about Alzheimer's has been a conversation about substances, amyloid, tau, whatever the protein of the month happened to be. Substances are easy to talk about because you can picture them piling up like sediment in a pipe. What this line of research points toward is not a substance at all, but a behavior. The behavior of a population of cells, changing over time, in a sequence. Those are very different kinds of problem. A pile of sediment, you clear. A sequence of behavior, you would have to understand well enough to interrupt at the right moment, in the right direction, without breaking the useful parts. Nobody is close to that. But knowing which kind of problem you are looking at is not a small thing. 30 years of effort went into the pipe, and it explains something that has confused a lot of families I've heard from over the years. Why two people diagnosed around the same time, with scans that look broadly similar, can follow such different paths. If the scan shows the damage but not the response, then the scan is showing you half of what determines the outcome. Half is not nothing, though it falls well short of the whole picture, and until recently we did not have a clear description of what the other half might even consist of. There is one more thing I keep thinking about with this study, and it has nothing to do with medicine. Somewhere a person lived past 100. They stayed themselves. They knew their family's faces. And after they died, someone in that family honored an arrangement that person had made, and their brain went to a laboratory. Because of that, a group of researchers could look at tissue that almost nobody gets to look at and see something about the human brain that mice could never have shown them. Every one of those donated brains is somebody's parent or grandparent, and the reason we know what we know this month is that they decided their brain should keep working after they were finished with it. That is worth sitting with for a moment. If you have noticed changes in your own memory, or in someone you love, the right move is not a video and not a supplement. Book a conversation with your doctor who can look at the whole picture in a way that nothing on the internet can. I will keep following this one. When something new turns up that is real, you will hear it here. And when the headlines run ahead of the evidence, you will hear that from me too. Talk to your doctor, take care of yourself, and I will be here next time.